Orthopaedic surgery in the context of a clinical negligence claim centres around surgery, typically to the bony structure, of course, and the musculoskeletal system that has gone wrong. And that has far-reaching implications for the individual concerned, because typically the surgeons are concentrating on the moving structural parts of the body, for example the hip, the elbow joints, the arms and the ankles. But of course, orthopaedic injuries don't just relate to surgery itself. They can relate to injuries that people have sustained that have not been diagnosed appropriately. For example, a fracture that's dismissed, not seen as a fracture, so people go on their way without realizing that they've sustained a serious injury. I think one would expect to know if one sustained an orthopaedic injury, because the outcome would not be as one would hope for. And with orthopaedic surgery in particular, the outcomes can have far-reaching implications for the individuals. And it would be quite clear if one has sustained an injury that has a significant impact upon one's functional ability and ability to carry on day-to-day life, domestic activities, and return to sporting activities and work. The purpose of compensation is to compensate someone for the injuries that they've sustained and to put them in the position they would have been had they not sustained those injuries. Typically it's divided into two areas: the compensation for an individual's pain, suffering and loss of amenity, and secondly for their financial losses. It's often the case that someone who sustained an injury is unable to undertake day-to-day activities or even return to work. And the purpose of compensation in those circumstances is to compensate for those losses. So that will, for example, include loss of earnings if one has been unable to work. It will include care and support that one might need as a result of a disability that has been sustained as a result of an injury. Claims are funded with the benefit of a no-win, no-fee agreement, which means that an individual client can take on their case without fear of having any responsibility to pay the defendant's costs in the event the claim is unsuccessful. There's no liability to pay Gadsby Wicks in the event the claim is unsuccessful, and there is no need for an individual to pay upfront costs or any costs as the claim progresses. The length of a claim varies greatly depending upon a variety of different factors. It depends upon the severity of the injury. It depends upon the number of medical experts that we need to instruct to construct and present that claim. And of course, a large factor in this is the defendant's response. If the opposing side to a claim admit liability and agree to pay compensation, then that would mean, or should mean, that the claim is resolved earlier. But of course, if liability is not accepted, then in those circumstances a claim can last for several years before complete resolution. At Gadsby Wicks, we force the issue and force the pace of a claim. We feel very passionate about pursuing a claim as quickly as we can to ensure the right result is achieved. How long a case takes depends upon a variety of factors. It depends upon the complexity of the issues, the value of the claim, the seriousness of the injury, and other factors, particularly the amount of time it might take for an expert to provide a report. One of the key features of the work that we do for you is to provide you with an indication at the beginning of how long your claim is likely to last, and we keep you updated throughout the process. Gadsby Wicks is a specialist clinical negligence firm. Every solicitor we employ is a clinical negligence specialist. The whole firm does nothing but that type of work, and all our resources and experience are geared to ensuring the best results for our clients.